So what is FGMC? Firstly, it stands for female genital mutilation and/or cutting. It is also referred to as female circumcision and involves the partial or total removal of external female genitalia and other harms to the female genital organs. It has been practiced in many countries for over thousands of years and is generally used as a rite of passage for young girls into womanhood and marriage. This has come to more than 200 million girls and women alive today that have experienced FGMC in around 30 countries in Africa, the Middle East, and Asia. FGMC is one of the biggest violations of human rights and is still being practiced currently on girls from infancy to adolescence, which is often done involuntarily or completely without the girl or woman's knowledge. The first myth is that FGMC is equal to male circumcision. Male circumcision is not the same as FGMC, only past the fact that they both involve genital cutting. But there are many distinct differences between male and female circumcision, and this begins with the underlying reasons. Both are claimed to be coming-of-age procedures. However, for men, it is symbolic of them taking their place in society as a man and someone of importance. However, FGMC is used solely to control a girl's or woman's sexuality. In a way, it makes them accepted in a society. However, it does not boost them in status or eligibility for leadership in any way, in comparison with male circumcision culturally, but only makes women and girls eligible for marriage. Male circumcision is also heavily referred to in religious texts, whereas FGMC is not at all. Secondly, the difference between male and female circumcision is what is actually being removed or essentially cut. In males, this is the foreskin, which does not affect a man's erectile tissues or urinary tract. Ultimately, the ability to experience sexual pleasure, to urinate, and fertility is not at all affected. However, this is the opposite case in FGMC in terms of the complete or partial removal of the clitoris, which affects a woman's capability of sexual pleasure, and in type 3 FGMC, this causes problems in urination and birth. It doesn't stop there, as there is risk of infections that continue to affect a woman for life if not medically attended to. According to the Royal Australian and New Zealand College of Obstetricians and Gynecologists, FGMC has no health benefits, but male circumcision can improve genital hygiene and reduce the risk of UTIs, even developing penile cancer. The second myth is that there are no long-term effects when it comes to FGMC, which is completely untrue, as FGMC can cause severe bleeding, which can lead to death, problems in urination and childbirth, infections such as urinary tract infections, development of cysts and abscess, and other effects on mental health such as the development of anxiety, isolation, depression, and PTSD, all of which continue to affect women or girls that have undergone FGMC for the entirety of their life. The third myth is that the procedures are performed by medical practitioners. This myth is partially true. In some countries, medical professionals or midwives will perform FGMC in private clinics. It is estimated that FGMC is performed by a medical professional on 1 in 5 girls. However, midwives are not qualified to perform surgeries in any way. Majority of FGMC cases are done by traditional healers, tribe leaders, community elders, relatives, and sometimes even barbers. This results in the use of unsanitized and unauthorized medical equipment for FGMC, such as broken glass, razor blades, and thorns, all used without anesthesia. The choice of equipment used, the place of procedure, and the unsanitary way in which the procedures are conducted all contribute to many risks for the FGMC survivor. The enforcement of these myths, let alone their existence, not only provides misinformation about a woman's body, but also damages her physical and mental health. It also excuses FGMC and facilitates its occurrence in countries, cultures, and amongst families. These myths need to be overturned to aid in the eradication of FGMC, and the support of FGMC-affected women should always be the main focus. As women are important, and when they are being violated, we should do everything we can to help and advocate for them past all the myths and procedures that harm women and girls. I think that as a woman, you don't have to be married or cut to be deemed worthy as a woman or girl, and every human has a right to be heard when being mistreated.